Hello, my friends. It's another episode of Staying Connected with the Worcester Senior Center. I'm your guest host, Dr. Michael Hirsch, coming to you from the Department of Public Health in the wonderful month of December. And you can see our wonderful studio staff has created this great holiday ambiance for us. Very festive, and even though I'm recording this towards the end of November, I really have a lot of that Christmas and in my house also Hanukkah spirit with me. But whatever religion you belong to, or even if you don't belong to a religion, almost every culture, almost every religion in the world has had some kind of major celebratory thing at this time of year since, recorded history. Why? Because I think even before people understood about the earth revolving around the sun and all of the planetary implications of that, it was scary as the days got shorter and the weather got colder, and people had to kind of reassure themselves that things were going to be okay. The darkness and the barrenness of the time of year. There's no planting going on. There's no soil to till. In general, unless you live around the equator, it's pretty cold. And so I think to reassure themselves, to kind of develop that sense of community, people gathered, and whether they called it under the aegis of Christianity, where Christmas is celebrated, or Hanukkah in the Jewish religion, or Kwanzaa in the African religions, there always was some kind of a celebration. And I think that always gives me pause, because I wish it could last the whole year. Everyone talks about that in context of Christmas, right? You hear all the carols, and you hear all of the good cheer and good tidings, and everyone wishing each other well. Wouldn't it be great if that spirit could last the whole year? But it usually, unfortunately, it doesn't. And maybe we individually can resolve, I'm going to keep this spirit in my head for the rest of the year. That's what's so wonderful. If you do read the book Christmas Carol by Charles Dickens, Ebenezer Scrooge, who was the bah humbug guy, didn't believe in Christmas. His world is turned around by the visitation of 4 ghosts on Christmas Eve. And when he wakes up Christmas morning, he realizes what a fool he's been, and he keeps Christmas in his heart forevermore. And I think that would be a great aspiration, to keep that kind of spirit going. I think we have a wonderful spirit in general here in Worcester. We, like a lot of communities all over the world, are going into now our 3rd year of working under these terrible pandemic-related conditions. And we just went through an election process where I think a lot of the messaging that came out of the elections was that people don't want to hear extremism, negativism. They want to pull the oars together and work together and be civil about it. The rancor and the ugliness of so many of the campaigns just didn't strike people in the right way. And they didn't know how to express it, and maybe when the pollsters called and asked them questions, they missed the point, because the polls were all wrong. Everybody that was predicted to have lost was surprisingly a winner, and those that were predicted to have won, many of them bit the bullet. And I think that it's a reflection of the fact that people want some calm. It's been pretty awful the last 3 years, with people like me from public health saying the sky is falling all the time, and all of the other political fallout from whether vaccines were good or bad, whether closing schools was good or bad, whether lockdowns were good or bad. Everyone's tired, and I get it. There is a post-pandemic depression, post-pandemic malaise, post-pandemic fatigue that almost everyone has experienced to greater or lesser degrees. Believe me, I know from our Department of Public Health, we're down a full 1/3 of our workforce because the people that have worked so hard there to try to keep the public safe here in Worcester, after the bulk of the pandemic was kind of petering away in the middle of the summer, they decided to check out. And they were dear friends of mine. I miss them terribly. I understand where they're coming from. But Mr. Debbie Downer, the pandemic is not over. And that's where I'm going to start today with a little bit of public health. Yeah, we talked last month about the possibility of a tridemic, right? That was going to be the simultaneous surging of COVID over the wintertime, of flu over the wintertime, and of this pediatric virus disease called RSV, respiratory syncytial virus, that has absolutely crushed the pediatric facilities for taking care of kids all over the country. ICU beds are at a premium. Admissions can't happen because there's no beds, and the emergency medicine staffs everywhere are just being crushed. And Worcester is no exception. We're seeing patients waiting down in the emergency room for 2 to 3 days to get a bed. We're seeing that we can't accept pediatric patients because we just don't have enough capacity, and we have to send them away if they need an ICU as far away as Eastern Maine Medical Center up in Bangor, or as far south as New York City. That's a devastating thing for a family to have to send a child and one of the parents or both of the parents or the whole family down that far or up that north, and not really know their way around that city that they got sent to. Oh, we're really reeling about this. Connecticut Children's Hospital is facing the same thing in Hartford, and they're building a tent that's being sponsored by FEMA to see if they can take the overflow from their children's hospital in this tent, which will be, fully heated and lighted and have all the facilities that you need. But it certainly doesn't feel right for a little child to be out in the middle of a meadow getting their care. So I've not been the most popular person in Worcester the last few weeks because I've been kind of warning people that I don't think the mask idea is a bad one to reinstitute. You may have heard me say that last month, that if you're a high-risk person for sure in the COVID spectrum, because the newest variant, which is called BQ1 and BQ1.1, and there's another one coming down the pike called BN. These are very transmissible, very short incubation periods. They won't make you super sick unless you're totally not vaccinated, but a lot of the vaccines that we've been giving out don't really respond to the right proteins on these new variants. These new variants have mutated so that the spike protein is different. So they can evade the effectiveness of the vaccinations. The vaccinations should still keep you out of the hospital, or at least keep you out of the ICU, but you could still get a hefty case of these new variants as they spread so rapidly. So all I've been saying is that if you're in an indoor situation, with all of the holiday gatherings that are going to happen in December, and you don't know necessarily that every single person that's coming to your house is vaccinated or that they're asymptomatic. Some people say, I just have a little stuffy nose today. I'm going to go to grandma's house anyway. And if they do, they can have it, not know it. Even if you test the antigen test that we've been using at home, it takes 2 negative tests to be sure that you don't have these newer variants because of how they're constructed differently. So that COVID part of the tridemic is definitely on the rise right now. The good news is that in Europe at least, which always kind of is our example because things kind of move from there to here over about a 6-week period, there the spike that BQ1 and BQ1.1 caused in cases rose high, not as high as Omicron last winter, but then it dropped off very rapidly. So it only lasted about 4 weeks. So if we could get through this month of December, early January, that should be in the rearview mirror. What we don't know is this BN variant that just showed up. How likely is that to just knock off the BQ variants, and maybe that has a different timetable altogether? I don't know that yet. But in any event, if you're the high-risk person, over 60, obese, with diabetes, cardiac or pulmonary disease, heart or lung disease, cancer, immune compromise, you are a high-risk person. You should be keeping your mask on. And those that live with you should be keeping their mask on to help you. And those that come to your house that are going to celebrate with you, if you don't want to have them test before they go across your doorstep, tell them to keep their mask on. If you do work in a work situation where one of these vulnerable people are working with you, out of respect to them, wear your mask in communal areas. If you are a parent whose child has got a runny nose, stuffy nose, little symptoms like that, we're urging people certainly to test. But if the child is looking like he has a cold, don't bring him to school. Do not let the other kids get exposed that way. I would certainly, and we have been in discussions with the city manager and the school health advisory council about the possibility of bringing masks back, because school-age kids don't get RSV very severely, but littler kids do, and a lot of these school-age kids have littler kids that can get sick from their acquiring it at school. So I don't think the mask is a bad idea. I don't think the mask is the worst compromise to make. The other things you can do, get your vaccinations up to date. Only 10% of our community has taken advantage of these new bivalent vaccinations that cover the original COVID-19 and then the new Omicron one. It doesn't specifically cover BQ or BN, but it'll give you some protection against getting super sick, and that's what we want. Now, why am I talking about this? Because currently, right now, we're having a crisis in all of the hospitals all around New England. The wait times in the emergency room are huge. 20% of the people that come to the emergency room to get evaluated are leaving without being seen. That's the most dangerous combination of all, because they could have something really serious. It may not be even related to a respiratory problem. They may have come in with chest pain, or they may have come in because they had visual stuff and they're like brewing a stroke or brewing a heart attack. And they're leaving because they don't want to wait there. And there's many, many, many ERs that are filled with babies that are having trouble breathing. It's a horrible atmosphere to be sitting and waiting. So any kid or any person that we can keep from having to go to the emergency room is a win for public health. So this is not the same situation as we had when we started out with COVID in March of 2020. But the overwhelming of the hospital system, it ends up being very similar. So the hospitals have stopped doing elective surgery. That has consequences because we're putting off surgeries that may, by the time they get done, when all this dies off, may be much more difficult surgeries, maybe surgeries that are delayed so long that they have worse consequences. So that's why I'm not popular, because I'm saying we should really consider going back to the masks indoors and including the kids in school. I think it's a small price to pay, and it just would be for the holiday time. Between Thanksgiving and after New Year's, we could see whether we could stem the tide a little bit. But we presented that to the Board of Health in their November meeting. They seemed sympathetic. We're going to try to craft something that they might be able to embrace, and hopefully then we might get some traction with the city manager and hopefully see if this might work. Now, I've gotten several people on talk shows that I have attended writing or calling in saying, well, isn't RSV worse because of masks? So that's something I'd like to drill down on a little bit. The reason we think the RSV virus is hitting our children so much is that over the last 2 winters, right, winter of 2020, winter of 2021, we were masking and social distancing, and that meant that we weren't exposing our kids to as much RSV. So many of them now, who are a little bit older, they're getting exposed to it for the first time, and it is giving them problems. So in some ways, yes, the masking may have made this event happen this year where RSV took off like wildfire. But in those days, we were using the mask, not so much considering RSV, but we were trying to save lives about COVID. You know, we have over 1 million deaths in this country from COVID. RSV is not going to kill most children that get it, with a few exceptions. And public health is all about the greatest good for the greatest number. And we don't really always know the consequences as we make recommendations in real time. I always talk to you about this. The city manager said, we're building the plane while we're flying it. We don't know all the consequences of what we are recommending, but we're finding that if we make 10 recommendations and 8 work out okay, that's a track record that we can stand behind. And I think that's kind of been our correct ratio of good calls to bad calls. There's going to be a lot of soul searching over the next decades about what went right and what went wrong with our response to COVID. I think that there's going to be a lot of fault finding in, the lack of preparation, the lack of equipment, the fact that we had farmed out a lot of our medication and personal protection manufacturing to China and other places outside of the continental United States. So, yeah, there's plenty of blame and plenty of blame to go around. I think you have to understand that there was no malice in any of the public health officials' hearts when they made these rulings. And that's what's been so unfortunate, is that because everything got politicized, it seems as if people are very distrustful of the fact that there wasn't some hidden public health agenda behind a lot of the recommendations that were unpopular. I still am incredulous that we haven't been able to achieve higher than a 65% vaccination rate in Worcester, and overall in the country, it's about 70%. I thought certainly by now, almost 2 years into having vaccinations, because we started vaccinations in January of 2021, I never thought that we would have so much resistance to it. And I think that that's going to be looked at as a major reason why we keep seeing these variants pop up, because there are people out there that are great incubators for these new variants because they're just under immunized. So we are in this crossroads right now where I think we could do some good to avert the hospitals from being overwhelmed, from having to take over the DCU center again, build a field hospital, all of these things. I think we could do much better if people thought about masks. So even if there's no mask mandate, there is a mask advisory. Think about that for you and your family. Think about that. I think the last item I will mention is I think monkeypox is in the rearview mirror. We haven't seen the kind of surge that people were predicting. I never predicted it, but it was talked about as being like the next great wave of epidemic, and we only have had 15 cases in Worcester that we've been actively following. I don't think there's much more infectious disease stuff I can talk to you about. But before we say goodbye and wrap up for this holiday edition, it doesn't sound like much of a holiday from what I've been saying. So I just want to say it's great to see all the festive decorations in people's homes and the things that they try to do to, brighten up the sky at night. Do me a favor. If you are a senior and you've always decorated your house a certain way, but now getting up on a ladder is a little more risky for you, please get somebody else to do it. Get somebody in the family that is a little more agile, maybe a little bit more balanced, because we don't want to see seniors falling. If the weather turns and we've got ice problems, ice dams, icicles, don't you be the one to go up on that ladder and try to knock them off or do whatever you think you need to do to clean out your gutters or whatever. It's just not safe unless you really are very, very steady on your feet. The ladder is not our friend. At the trauma center, it is every single winter we are seeing patient after patient after patient having fallen from a ladder, fallen from a step stool, trying to do decorations in their house, trying to fix their ice dams, trying to seal holes in the roof, things like that. Get the professionals to help you whenever you feel like you're really not up to getting up on those ladders. Also, it gets cold. It may be a cold winter here in Worcester. Watch out for the heaters. Some still operate on kerosene. They're very, very dangerous. If you bump into them, if your pet bumps into them, and they fall and something catches on fire, the flames can spread very, very rapidly. If you have a smaller child in the home who's toddling around, they can cruise around and land their hands on it and get burned. And we also see, even with the electric heaters, they take up a lot of electricity. And don't you put them into a plug that has like one of those plug extenders and there's 18 different things that are plugged in. Maybe you have different sets of strings of lights that plug in, and you're then on top of it, you put in one of these electrical ones. The whole house short circuits and you end up with an electrical fire. Some of the bravest that we've had here in Worcester Fire Department have been involved in fires that were sparked that way. We all commemorate the cold storage fire on December 6th, and that was allegedly sparked by, some homeless people who were lighting a fire in that old warehouse, and unfortunately fled the warehouse without letting anyone know that the fire was still burning. So this is sometimes a sad time of the year for our Worcester Fire Department, and I have nothing but praise for them. We at the Department of Public Health share the building with the fire prevention section of the fire department. These guys are incredibly brave and incredibly active. They're in schools and in homes trying to emphasize that everybody that is in a home should have an escape plan, and they'll come and do an evaluation for you. If you call the fire department prevention group in our building on Lamartine Street, they'll come and help you map out the right route. It's a very good thing if you're a homeowner to know, even if the lights go out and it's smoky, which way is the safest way to get out. So these are the kind of things that nobody wants to hear about, right? At holiday time, about fires that have left people homeless or killed people. Please, please, let's help our fire department not have to deal with any of the trauma of taking care of one of those fires and unfortunately finding a body badly burned or a body that didn't make it. It's a very traumatic thing for everyone in the city. We also know that, when we put together these family gatherings, that sometimes a little too much alcohol gets used. Please consider being that solid host that says, I don't think you should drive home. Why don't you sleep on the couch? Or why don't you give me your keys? Drinking and driving is not cool. It's really amazing how it has changed. When I was growing up, and probably when you were growing up, there'd always be the funny drunk, and on TV shows and things like that. There's nothing funny about it anymore, and now more and more, bars and restaurant establishments, if they see people that are tipsy from whether it's drinking or using drugs or smoking marijuana, they will, step up. And we call that being an upstander, not just a bystander, but an upstander, and say, hey, I don't think you should drive. It's actually their responsibility, if they see somebody like that, to say something about it and try to intercede, because they're liable if they send that person back out on the road. So these are the hazards that we see quite a bit around Christmas time, and nobody really wants to ever deal with Christmas time being associated with a loss of life in the family, because you live that every single Christmas after that. And I have taken care of a lot of children who have had bad crashes, bad cancers, bad outcomes at Christmas time, and I can tell you from experience, those families never experience Christmas again in the same way. So we can do better. We can police ourselves and make sure that we're not intoxicated when we're driving, that we're not speeding, that our judgment is better about, if there's an ice storm going on right now, I don't really have to go home right now. Is that okay if I just wait it out for a couple hours? These are the kind of great decisions that we like to see people make. And again, I lean on you as seniors because you're the voice of reason in your families. So if you have those kind of family gatherings, keep your eye out for that. Or maybe you'll have a nice nephew or daughter or son who comes over and says, so-and-so has had a little too much. Maybe you could help me talk to them about not driving tonight. Beautiful. And designated drivers are kind of popular now, and that's where you tell one of your family that comes, you're not going to drink. You can reward them with an extra piece of turkey or Christmas cookies or whatever. But that's another very effective way of making sure that there's a safe way to get home. So I would say that December is supposed to be a joyous month. We can make it a joyous month if we take some public health precautions, if we take some everyday precautions when it comes to family gatherings, if we are sensible about decorating your homes without putting your lives at risk high up on the ladder, or doing contortions that you're not meant to do anymore. December for me has always been an amazing month because I this year will be married 43 years. I got married on December 29th, and my soulmate is still with me. And I think in a couple of weeks, my daughter is going to be delivering a baby girl. So I think December is even going to take a more special meaning for me moving forward. And maybe next year, if I'm still doing these segments with you, I'll be able to report back great things about my granddaughter. But in the meantime, I hope that all of you have a blessed holiday season, one that is filled with health and safety and joy and love. And let's move forward into 2023, confident in the fact that Worcester has kept itself together. We've hung together through thick and thin, and we'll continue to do so until we put a lot of these stresses that we're going through into the rearview mirror. So, merry whatever you celebrate. You can fill in the blank. I wish you all the best. Thanks a lot, and we'll see you next month.